Hi all, I'm Kevin Jason, first year MSW of student of Christian College. I am here to present this casework study on psychiatric hospital for adolescents. So, what is a social casework? According to Major Richmond 1922, social casework consists of these purposes or processes which develop the personality through adjustment consciously affected individual by individual between the men and their social environment. So in social a social case worker is not a social worker, but it is employed by the government or any government agency or non-profit organization to take the case of individual and provide them with right information and solution according to their problems or needs. A social worker who works as a caseworker obtains social casework education and training naturally through their compulsory degree works in social work, caseworker means to engage a client in learning their situation to build a suitable plan for action and helping the client to solve their problem through their client's commitment and use of their own and community resources. The coordinated service is called case management. It is a primary approach and a method of social work concerned with the adjustment and development of the individual and in some instance couples of leading them as a unit towards more satisfying human relations. In social case for a relationship between a caseworker and a client is one support focused on enabling the individual for solving the problems through their self-effort. And psychiatric hospitals the psychiatric hospitals offer the utmost standard of care to the adolescents and they're designed to address create mental health concerns in short term. These facilities provide the secure environment with continuous and oversight ensuring the safety of the patients. Comparable to the medical facility designed to the address like physical elements, a psychiatric hospital is established to address the updraft mood or behavioral alteration necessary for the structure and intervention to ensure the safety of the adolescents. The mental health hospitals are designed with the purposes of conducting a meticulous assessment of the crisis, promoting interviewing the civilizing adolescent and formulating a comprehensive and ongoing care. The facilities at the psychiatric hospitals are costly to maintain and are designated to evaluate the adolescent stabilize the crisis and offer specialized assistance and facilitate the transition of adolescent into a less demanding program. Now comes the models of social casework. There are six models of social casework, and the first one is psychoanalytical model. The psychoanalytical model was developed by Sigmund Freud, and the contribution of psychological model is understanding of the conscious, the pre-conscious, or and unconscious. That is the id, ego, and the superego. It helps the social caseworker to understand the psychological motives of the client, including the effects, anxieties, coping capacities, defense and consciousness and unconscious forces of the person. Next comes the psychosocial therapy. The psychosocial therapy means the approach of the psycho. It was introduced by Florence Follis. That is necessary to understand the inner relations of the human beings and the social content in which he or she lives. It focuses not only on the situational concepts of the client stress and also the client stress also on his personality, including the previous experience and ego functioning. Then comes the problem solving model. The hospital is viewed as a problem solving organization. The problem solving phase is casework focus on the identification of the problem to be worked on the breaking it down into the manageable parts and establishing the limited goals. And the in problem solving model, it emphasizes on the present problem of the client. It by partializing into the breakdown the caseworker break down the individuals each problems and find a and the caseworker gives a kind of confidence to the client and helps him to overcome the problems. Then come the next model is the crisis intervention. The crisis intervention means the model casework is an effective approach with the reference to the some situations. It helps the social worker examine the effect of the stress and anxiety on individuals to assess their coping mechanism and problem solving abilities and help them to mobilize their own resources and find solutions. Then comes the behavior modification model. This model focus on identifying and reinforcing the positive way while minimizing or extinguishing the negative ones. It also helps to learn the new adaptive ones by utilizing the behavior modification approach. Then comes the sociological model. It is said that the developing countries' sociology theories are useful in the analysis of society, which facilitate the social work interventions. Uh, then comes the model which I have taken is psychosocial model, and it was done by it was made by Florence Hollis. Florence Hollis Florence Hollins, the Florence Hollins is known as the academic of the Bible of the clinical practitioners. A psychology therapy introduced the readers to the basic theory and principles of the historical development of the approach as it has been enriched and expanded over years. The author's approach reflects a balanced focus on people, their environment, and their ways in which interact with the environment. She did her, and Florence always did her undergraduate work at Wesley College, relieved her master's from Smith College, College of Social Work in 1931, and her doctorate from the Byron Moore School of Social Work in 1947. Through the through these years, she worked as a family agency in Philadelphia and Cleveland, where she taught her part-time at Western Reservoir University. Uh, she was the editor of the Journal of the Casework during the 1940s and 47. She developed her typology of casework in procedures, well, which became the basis for ongoing. She developed the typology of casework procedures, which become the basis for ongoing and rigorous research on into worker-client communication and the casework process. Uh, uh, Now we are going to see how psychosocial model affect the psychiatric hospital for adolescents. Adolescence is the transitional age where development between the childhood and the adulthood, representing the period of time which persons experience a variety of biological and emotional changes. Many researchers have tried to define the psychosocial dysfunctioning in many ways, but confusion remains. However, the understanding regarding the psychosocial dysfunction concludes that it is the state of emotional and behavior disorders synonymous with inter-analyzing and externalizing the condition. Around 20% of the adolescents encounter at least one behavior problem, half of the lifetime mental disorders being before the age of 14 years, and 75% of being at the age of 24 years. Insufficient focus on mental welfare of children and adolescents during a crucial stage of social development can result uh, in enduring mental health implication and hinder the overall socio-economic productivity of societies. There are a number of factors that may affect the patient's short-term treatment trajectory. In developing a patient-centered approach, it will be essential to identify which the clinical psychosocial factors influence whether the patients have appropriate symptoms stabilizing to avoid the negative outcome of uh, the negative outcome of their problem. The psychosocial model prioritizes a holistic assessment of patients. In psychiatric hospital for adolescents, this means considering it not only their clinical symptoms but also their social, emotional, and environmental factors. Treatment plans are tailored to address the unique psychosocial needs of each adolescent. This model also approach each adolescent that all aspects individual well-being are considered. The social workers advocate for the rights and needs of the adolescents within the hospital, and it is the interaction with the external agency and organization. The hospital may implement preventive measures to address the psychosocial issues, and education and support programs aim to equip the adolescents with the skills to navigate the challenges. When it comes to the conclusion, the psychiatric hospitals plays a major role in providing intensive mental health and treatment and support the individual in crisis. The goal is to stabilize their mental health, provide counseling skills, and help them on the path to recovery and overall well-being of the individual. The psychosocial model of care in psychiatric hospital for adolescents shifts the focus beyond the clinical symptoms to address the broader social, emotional, and environmental factors that implement the young patients. Social workers play a major role in promoting the recovery, resilience, and overall well-being by considering the complex interplay between the clinical and psychosocial factors in the interventions and support. The adolescents can vary widely depending on individual circumstances and the quality of care received. It's the important for the healthcare to provide to address these models aspects comprehensively. Thank you.